There are a lot of lies and misconceptions surrounding the American healthcare system, so I've made a video to help clear some of these things up. One of the myths surrounding American healthcare is that it's not very good. It is. In terms of quality, American healthcare is on par or better than any other system in the world. The only reason why it ranks poorly in comparison studies or statistics is because of unfair double standards or biased rankings that prioritize single payer systems. It's true that American healthcare is a lot more expensive than most other countries, but the quality is second to none. Doctors in America earn salaries that are multiple times higher than doctors in other countries. This attracts top talent, fosters the development of cutting edge treatments, medical devices, and pharmaceuticals that benefit people worldwide. In many cases, patients have a wide selection of doctors, specialists, and hospitals to choose from. This can empower individuals to find providers who align with their specific needs and preferences. American hospitals often boast world class equipment and facilities, especially those associated with academic research centers. This provides access to the latest diagnostic and treatment capabilities. The U.S. system excels in complex and specialized treatments, such as cancer therapies, organ transplantations, or intricate surgeries. Mike Hawley notes the U.S. healthcare cost crisis didn't start until 1965. The government increased demand with the passage of Medicare and Medicaid while restricting the supply of doctors and hospitals. Healthcare prices responded at twice the rate of inflation. Milton Friedman tracked a similar rapid increase in the cost of healthcare following the introduction of Medicare. Paradoxically, with an increase of input, when measuring costs per patient per day in constant $1982, there was a fall in output, as measured by hospital beds per 1,000 patients. Here's a brief history of efforts by the U.S. government to restrict the supply of healthcare. In 1910, the AMA forced the closure of half the medical schools and reduced admission among the remaining ones, greatly decreasing the supply of doctors. In 1925, you have the introduction of drug patents, which are a grant of monopoly privilege and artificially restrict the supply by only allowing one firm to produce the drug and to sell it at whatever price they want. 1972, they introduced certificate of need requirements for new hospitals. So, regulatory compliance that organization wants to build a hospital has to go through, and of course, they can be denied. 1984, extension on drug patents beyond 20 years. And Mike Hawley goes on to explain since the 1980s, the government has used its buyer monopoly power through its Medicare and Medicaid programs to effectively set price and quality controls on physicians and hospitals. For the same purpose, the federal and state governments promoted the concentration of private insurance into buyer monopolies, e.g., HMOs. The government also encouraged clinics and hospitals to respond by merging into concentrated provider monopolies while continuing to limit the supply of doctors and hospitals. These government private partnerships, called managed competition, resemble centrally planned fascism. Government set prices, which has predictably led to reduced quality, rationing, and other perverse gaming. Moreover, the bureaucracy has brought standardized care, higher administrative costs, and higher executive salaries. Although costs have continued to rise at the same double the rate of inflation, it is questionable the extent to which prices are now set by the laws of supply and demand. In England and Canada, millions languish on waiting lists, victims of socialized medicine. Despite being one of the most expensive healthcare systems in the world, Canadian healthcare performs below the OECD average. When it comes to objective metrics like number of physicians per 100,000 or beds per 100,000, Canada is ranked 25th out of 29 and 27th out of 27th, respectively, based on academic studies. One main reason for Canada's failure to perform is because of its unique fear of private sector healthcare. Canada effectively bans private healthcare through regulation. Only 1% of healthcare in Canada is private. By contrast, Germany, France, and the Netherlands all have thriving private options, which takes some of the pressure off of the public system. The Swiss system is fully private, with subsidies for low-income individuals so they can afford insurance.